Today, I want to share with you about our ERISA compliant and IRS approved virtual healthcare platform designed specifically to help employers save in payroll taxes while simultaneously providing their employees with additional benefits with no change to their net take home pay. Now, we are in a climate where employers are trying to do everything that you can to reduce expenses, while at the same time providing additional benefits and value to your employees to help with retention and to help with productivity at the workplace and also at home for the employee as well. And so our program called SMRP is the Self-Insured Medical Reimbursement Program. Now, where this came about for the last decade or more, the government's goal has been to help Americans become healthier, to give us access to more healthcare, to reduce the burden on the healthcare system, while also reducing the burden on the future Medicare system as well. And so there's a lot of detail in this, but we're going to just stop for a second and talk about three main benefits before we dive into the details. So on the employer side, this program will allow you to save in payroll taxes. On the employee side, they're going to receive two benefits. They're going to get access to the virtual healthcare platform, which allows them to have healthcare and other benefits virtually. And then the other part for the employee, their benefit will be that they'll receive additional monies that they don't have to pay toward payroll taxes, but will be an allotment or an allowing of them to utilize that money to purchase additional supplemental benefits for them and their family. So let's look at what that means for you first as the employer. What that means is immediate financial impact to your bottom line. Because the utilization of these tax codes, it will reduce the employer's FICA taxes while reducing your contribution as well. And so that savings is around $550 per employee per year on annual average savings. What this also does with the implementation of the virtual platform and the additional benefits, it allows you as the employer to offer something to your employee they might not be able to receive at another place of employment. So that's going to increase retention, loyalty, and productivity. We know that if our workers are healthier, they're going to be more productive and happier at work. And so this just allows you, while you're saving on the payroll side, allows you to be able to offer more in way of benefit and value to your employee. What we've also seen is that the utilization of the healthcare platform means that there's going to be a reduction in claims costs. Generally, when employees use the virtual platform, they're going to go to the doctor less, they're going to go to the ER less, they're going to need mental health benefits through their major medical plan less as well. And so generally we see on average a 3-year savings of about $1,400 per employee, which is just additional savings on top of the FICA taxes that you will receive savings from immediately through implementing the plan. Now, the other part is because this is a program that has to be implemented. What we want you to know is this is fully automated, very simple implementation. We have CPA, we have TPA, we have our agents who are available to help enroll to make this a seamless process for your HR and for your payroll department. And so you don't have to worry about trying to implement this big complex plan. This is something that we come alongside and help the HR and payroll departments implement. Now let's look at the employee side of things. I mentioned the virtual health dashboard that they'll receive. We'll talk about specific benefits in just a minute, but they're going to receive access 24/7 to telehealth, doctors, nurses, life coaches. And the great part about that is there's no copay that they have to pay. It's included within the platform. There's also holistic health coaching to help them set goals for being healthy, help them lose weight, stop smoking, additional benefits there as well. Then the world's first ever self-guided virtual addiction recovery program, along with couples counseling that they'll receive access to as well. And so as I mentioned earlier, because of the tax codes, their FICA amount or their payroll tax amount will be reduced, which creates an allotment that is around $150 a month per employee. Now we get a census from your department, payroll department, and we send that off to the IRS, and the IRS is going to tell us based on the filing status, their marital status, how much each individual employee will receive as an allotment or reduced taxes that now they can utilize to purchase the supplemental insurance benefits like accidental, cancer, hospital indemnity, critical care, all the benefits that they'll receive in addition to what they already get from your place of employment, again, with no change to their net take-home pay. And we'll look at a paycheck example here in just a minute. But let's look again back on your side of things. The virtual healthcare program is fully employee funded, which means there's no out-of-pocket expenses from you, and there's no change to the employee's take-home pay. So let's say, for an example, you have 100 employees. On average, you're going to save about $550 per employee, which means over the course of a year, your average savings as an employer is around $55,000 in reduced payroll or FICA taxes. Now, 1,000 employees, over $500,000 in savings. So you can do the math based on how many employees you have times 550 average per year per employee. Okay, so the program does have some qualifications that we have to fit within because it is a program that is, again, ERISA compliant, IRS approved. So the first qualification means that the employee has to be W-2. This does not provide coverage for a 1099 commission salesperson. This just covers W-2 employees. The other qualification is that they have to have some type of health major medical plan in place. That can be your sponsored plan as an employer. That can be through their spouse's plan, or if they're under 26, it can be through a parent's plan, or they can have their own individual policy through the workplace as well. And if they don't have any of that, we can come alongside and help provide that or implement that for them so that they can qualify for the wellness program as well. So the third qualification is that the employee cannot be receiving any federal funding, can't receive Medicare or any type of supplement for the marketplace. So as long as they fit within those qualifications and parameters, the employee qualifies for the virtual healthcare program. So let's look at a couple of specific benefits they'll receive through that platform: counseling, financial help, work-life balance, legal advice, will, divorce, bankruptcy, and so much more that is involved in this plan. Completely confidential. This is what's great. It doesn't require any type of registration. They don't have to go to any type of office or worry about being seen. It is completely confidential. The employee will get these benefits and access to these virtually so that they can do that in the privacy of their own home. The other part of that is through the United Concierge Medicine. They're going to receive access to virtual healthcare, emergency room visits, all licensed professionals and physicians through the health dashboard. Those physicians 100% of the time follow up with patients to make sure they're cared for, taken care of. Again, the employee pays zero copay for these consultations. Now, through your major medical plan, they probably have an office visit copay, but if they utilize the healthcare virtual platform, there's no copay for those physician consultations. And again, unlike a regular doctor's office, this virtual platform is accessible and available 24/7 through phone, tablet, computer, however they want to access the app or through the website. It's available 24/7 to them. So let's look at if your employees utilize the ER function there where they can call in and ask some questions through a licensed physician. So what it does is it's going to reduce their time away from work. It's going to reduce their need to go to an office or to have a visit physically at a building or location. And so utilizing this healthcare platform obviously gives them additional benefits, but it reduces their time away from work. And so through that, over the course of time, you'll see additional savings because your employees will be present more often. And while they're present, they're going to be healthier physically and mentally as well. And so on top of the FICA payroll tax savings you'll receive, you're also going to see some additional savings because your portion of paying for the major medical events are going to be reduced as they utilize the healthcare platform as well. So I mentioned earlier couples counseling. It's called Couples Wise, and it provides, again, for the opportunity for your employee and their spouse to have these conversations with a licensed counselor in the privacy of their own home. They don't have to worry about going to a building or being seen in town or worry that somebody's going to see them and wonder if their relationship is healthy or not. And so they can do this virtually in the privacy of their home. They're going to develop and learn skills, healthy behaviors to help them have a long, satisfying relationship with their partner. And again, that just creates a healthier employee that can be more present physically and mentally at work. I mentioned earlier the world's first virtual self-guided recovery system. It's known as Freedom 365. Again, it's all built into the app. It's all virtual. They can guide themselves and walk themselves as the employee through learning how to change behaviors and triggers to develop new habits, to not lean on or be tied to the addiction, but to find freedom from that. And if you've ever had an employee who has failed a drug test or had to go to addiction recovery, you know the cost and the expense to the employee, and then also to you as the employer as well. Just the time away, the absenteeism, the not being present when they are physically present at work. And so again, this is all built into the virtual healthcare platform that your employees receive as being part of the program. Again, there's a holistic health coaching that's going to help them stop smoking, eat better, manage chronic illness, which then reduces claims costs on major medical, just helps them become physically and mentally active and healthier as well. And again, all of this is secure access at the fingertip of your employee through the virtual dashboard and through the app. And it is HIPAA compliant, HIPAA protected. So they don't have to worry about anybody seeing them or seeing their information. They get access to it right there at their fingertips. And so let's look at what this means utilizing the tax codes for you as the employer and for the employee, what it looks like on their paycheck. So let's start first, just as they are right now without the program being implemented. And let's start with an employee whose take-home pay is $5,000 a month, just monthly to make it very simple. So $5,000 gross pay. Now you have a major medical or they have a major medical plan in place. And let's say you have one at your office or your business, and their contribution to that healthcare plan is $300 a month. And again, we don't make any changes to your major medical. These are just supplemental additional benefits that you can offer to your employees. So this employee's contribution to their health insurance is $300 a month. So 5,000 minus 300. Their taxable income is $4,700 for the month. And so as a part of that, they have to pay federal taxes, state taxes, Medicare, Social Security contribution, and all that leads to $1,253 in tax deductions. So if you take both of those, the tax deductions along with their health insurance contribution, that employee's net take-home pay is $3,446.68 for the month. Okay, and as I mentioned, the implementation of this program makes zero changes to their net pay. We're going to utilize the 4 tax codes to implement the program to help your employee receive the additional benefits with no change. So let's look at what that would be with the program implemented. As I mentioned earlier, this is completely employee funded. So let's start back with their gross pay, still at $5,000 a month. Their health insurance, major medical, no change to that. Their monthly contribution is still $300 a month. Now, this is, again, employee funded. So on one side of their paycheck, the employee is going to pay for the virtual healthcare platform. But because of the IRS tax codes, we're going to be able to reimburse them that same amount on the same paycheck so that they basically receive that benefit with no change to their pay. But what it does, it is going to reduce their taxable income. No longer is their taxable income $4,700, but now it's $3,800 because we have been able to implement and reimburse the program post-tax. So what that does is it will reduce their deductions, federal, state, Medicare, and Social Security. Now, those deductions are $948.53. If we look at that, the difference now of tax savings is $304.79 for that month for the employee. Now, there is an administration fee for administrating the program and the platform. We handle all of that. Again, CPA, TPA provided for a seamless process, which leaves an allotment or an allowance of $224.79 for this individual employee to then be able to utilize to have access to or to purchase supplemental additional benefits. And let's look at what those might be. And we're going to come in and talk with each employee to see what really their needs are so that they can choose supplemental plans that are going to fit their individual needs or their family needs as well. And so for this employee, they added additional cancer, accident, disability, and life insurance with that $224.79. Again, there's the administration fee because we're going to help administer the program for you. The health insurance contribution that the employee is paying for their major medical does not change. You go back and you add in the tax deductions now based on the program being implemented, which then leads to the employee's net take-home pay to still be $3,446.68. And so the employee is still receiving the same pay, net take-home pay every month. They're also receiving the virtual healthcare platform. And now they're receiving 4 additional insurance policies to help them meet their needs physically and mentally with their health, which again will make them a more productive citizen, but also a more productive employee that helps you create retention and loyalty because you're offering this to your employees that maybe they can't get at any other place of employment. So now let's look at your side of the savings. As I mentioned earlier, this is going to reduce the employee's taxable burden, their taxable income. And you as the employer, you have to match the Social Security and Medicare as well. So because the employee's taxable income has been reduced and their tax burden has been lowered, your portion of that, your contribution of that has been lowered as well. And so there's an administration fee for us to administer CPA, TPA to administer your portion of the wellness program and the virtual platform. And so once you take the savings of the payroll taxes and then you take out the administration fee, you'll see the net savings of about $550 per employee per year in the match of payroll taxes that you're responsible for. Now, here's the other thing. You may have a cafeteria plan in place. That's perfectly fine. Most other places charge you for the cafeteria plan. We don't charge you for that, which creates some additional savings as well. All of that is included in the virtual healthcare platform. Okay, so you may have some more questions. You may want to just sit down and have a conversation virtually or in person. Perfectly fine. This video is just meant to help you get some of the basics on how the platform works. But if you do want to take next steps and see what this might mean for your place of employment or your employees, the first step we would do would be to complete a census. We would get all the information. We would connect with your HR payroll department. We would get the basic payroll information for each employee. And then what we're going to do is we're going to send that off to the IRS. They're going to look at the employee's filing status, marital status, all of the basic information they need to then give us a breakdown. And when we receive that back from the IRS, we're going to know, and you're going to know exactly how much savings you will receive as the employer and how much each individual employee will receive in additional benefits each month. And then the third step of that, we'll come in with our enrollers, with our agents, and we will sit down with your employees, again, in person or virtually, and we will help them choose the additional benefits that they need most for themselves or their family. We'll help them get that set up and enroll. And then our CPA, TPA will come alongside your payroll department, help them connect that with your payroll software so that it's a seamless process to make it as easy of an implementation as we can. And then the fifth part of that is you're going to start saving monthly on FICA payroll taxes, and then your employees are going to receive those additional benefits starting the next month as well. And so thank you so much for taking a few minutes, allowing me to share the program and the platform with you. If you have questions, you can reach out, but hope this was helpful for you and hope you have a great day. Thanks.